For our last speaker, I'd like to introduce you to Dr. Jessica Toste. Dr. Jessica Toste is an associate professor in the Department of Special Education at the University of Texas at Austin. She holds research affiliations with the Meadows Center for Preventing Educational Risk and Texas Center for Equity Promotion. She has worked on research focused on intensifying intervention for students with persistent reading challenges, and she has been principal investigator on grants from the U.S. Department of Education's Institute for Education Sciences and Office of Special Education Programs, and the National Institutes of Health. She's currently the editor-in-chief of the Reading League Journal and associate editor for the Journal of Learning Disabilities. Please help me in welcoming Dr. Jessica Toste.
Hi, thank you for the introduction. Very excited to be here and excited to share some key ideas about using assessment to inform Tier 2 and 3 intervention support. So really thinking about how to use the assessment data that you're collecting to make instructional decisions that can provide supports to your students. So I'm going to start with a very brief touch on reading success and kind of setting the stage for why it's so important to use data to make instructional decisions. And then we'll get into the bulk of what I want to talk about today, which is around database decision making. So I'll talk a little bit about the levels of support for students and then align that with different types of assessment data you would collect at these different levels, and then go into a little more detail about data-based instruction. So how to use data in a systematic way to make instructional decisions. And I'll end off kind of with some big takeaways, hopefully summarizing ideas from across what we discussed together. So first, in thinking about reading success, keep wanting to press my keyboard, but I'm not going to. You've had other sessions today and throughout this year talking about all the things involved with reading development and reading intervention. And reading is an extremely complex cognitive process. For many students, it requires more intensive support to help guide them through that developmental process. And most of our students need some level of high quality support to guide them through that developmental process. So for all of our students, and then especially those who have difficulty with reading development, we want to make sure that all of the instruction and intervention we're providing is guided by the science of what works, for whom, and under what conditions. So really making clear decisions about how to support students instructionally. In the US, there are about 2.4 million students identified with learning disabilities. It's the largest category of students who receive special education services in the country. And among students with learning disabilities, we know that the most common area of difficulty is in reading. The NIH has recognized reading as a significant public health issue that really requires focus in order to support students in acquiring this skill. So we know that beyond the 2.4 million students with learning disabilities, many more students have difficulty with reading. And so we need to understand how to support all of our students to grow as readers. Thinking of these two, the reason I shared these main points is really considering the complexity of how we as humans develop as proficient readers, combined with the number of students across the country who experience some level of difficulty acquiring proficiency. It's really essential that we have a strategy at the state, district, school, individual level for how we're going to make systematic, well-informed instructional decisions to support our students. So if we think of how service delivery models work, you have MTSS or RTI, different service delivery models that we've had acronyms and names for over the years. But what these all share is the idea that we have a structure for integrating instruction, intervention, and assessment at varying levels to meet students' needs. These service delivery models really ensure that all of our students are receiving well-implemented, research-based reading instruction practices, and then intervention supports as they're needed. And so combined with this is strong core instruction, and then prevention and early intervention when students require that. I'm not going to talk too long about this triangle model, but give a brief overview to guide to connect us to the assessment parts we're going to talk about. So we know when we see this model for MTSS or RTI, for service delivery frameworks, as we move up in the triangle, we're increasing the intensity of supports that students need. And so at the universal or tier 1 level, we're hoping that most students, 75 to 85%, so most of the students in our class are going to have their needs met by this high quality classroom instruction. Then at tier 2, we're talking about students who need additional targeted instructional supports. So it's estimated that potentially 15 to 20% of students require some additional support to supplement the core curriculum. And then at tier 3, there's more intensive supports provided for students. So this should be at tier 3, students who are receiving this level of support, around 3 to 5% of students who are at higher risk for not showing adequate response to the intervention that they've been receiving at tier 2 or the instruction they've been receiving at core. And at tier 3, the supports really are much more individualized to the needs of the students. So thinking of how we provide supports at these different levels, one important way to do this and one important way to have a strategy to do this systematically is to collect student assessment data. So we want to make sure, in order to inform instruction, that the data we're collecting is brief and efficient to be administered. So it's not taking away from our instructional time. It's brief. We can administer these. They're easy to train folks on how to administer them. They're also reliable and valid measures, so they're brief and easy to administer, but they're also giving us reliable information about students' skills. And we want to make sure the data we're collecting directly informs instruction. And sometimes we're not sure how it's directly informing instruction, but really taking time to think about how to use the data we're collecting to inform what we're doing instructionally. So I'm going to focus on one kind of bucket of assessment data called CBM, curriculum-based measurement, and talk a little bit more about this. So CBM is a system of ongoing data collection to monitor student performance. CBM probes, so CBM systems were originally developed more than 50 years ago now, with the goal of informing instruction. The purpose of collecting CBM data was to directly inform what teachers were doing instructionally. CBM probes are designed to produce scores that are reliable and valid so that they give us accurate information about students' performance. They're designed to be sensitive to change, so they're designed to be looked at over time to help understand students' academic trajectories. And they're designed to be simple and efficient to administer. So several examples, this is certainly not exhaustive, but some examples of different CBM systems that you have probably heard some of these names: DIBBLS, AimsWeb, EasyCBM. These are different systems that are in place that have curriculum-based measures within them. So I'm going to focus on kind of in reading a very common selection of CBM. And so most commonly when we're collecting CBM data in reading, we focus on a measure that involves students reading a passage aloud. And most of these systems call this oral reading fluency. Some of the systems call it something different, but it's often in the range of ORF, or oral reading fluency. We look at the number of words that students read correct in a 1-minute timed reading of a passage. And the reason why ORF is so effective and why we often focus on it when we're monitoring students' progress is that ORF, or reading fluency, really serves as a proxy for overall reading performance. So understanding students' oral reading fluency over time really helps us understand how they're progressing as a reader. It doesn't necessarily tell us if there are more foundational skills that are leading to the fluency, but it gives us a proxy for what's happening overall. There's been several kind of synthesis and reviews of work, but one that's cited very often is by Wayman and colleagues, and they found that studies that looked at the technical adequacy of ORF, or CBM, in reading found that these scores were strongly associated with standardized measures of student reading achievement. So ORF scores for students throughout the years were highly related to their performance at the end of the year and their likelihood of success on standardized assessments. So going back to this model and thinking about where these assessment pieces fit in, I'm going to talk about two different ways that we would use CBM data. And as we go up this model, we're increasing the way we're using this assessment data, but also the frequency with which we're collecting assessment data. So at core in tier one, we're using universal screening. So this is looking at all students to understand their performance. And as students move into tier two targeted supports and then intensive tier three supports, we're using progress monitoring data to monitor them more closely so that we can understand whether the instruction and intervention supports we're providing are actually meeting their needs. So what are some different screening and progress monitoring? So universal screening first, as I mentioned, this is administered to all students as part of a school's instructional planning. So this is done school-wide to look at how students are doing overall. And I'm going to talk about two different kinds of universal screening that we engage with. One is screening for risk. So this is all students are assessed to look at their potential risk of reading difficulties and help us determine who might need intervention supports preventatively. So in order to provide early supports that will prevent increasing difficulty in the area of reading. So screening assessments are usually administered annually. And I put an example here in California. There, as of next year, there's going to be screening for risk with all K2 students using one of these four assessments. So AMIRA, M-CLASS, Multitudes, or ROAR. And that data will give important information looking at all of the students in your class who needs to move on and receive additional supports. The other type of universal screening data we use is looking at benchmark targets. So benchmark assessments are often administered about 3 times a year. So most schools and districts will collect benchmark data beginning, middle, and end of year to look at how students are coming into the grade and performing, and then how that changes or grows or doesn't as the year progresses. And so the goal here is similar to screening for risk, but really looking at assessing students' performance compared to benchmark targets to identify whether they're meeting those grade level benchmarks as they move throughout the year. So the purpose of universal screening is really to catch students early and to make sure that that we provide preventative service supports or early intervention service supports so that the difficulties don't progress. And I like to share this quote here: an ounce of prevention is worth a pound of cure, which if you've heard this before, you may know that it was related to forest fires, which is not exactly what we're doing in our schools, although sometimes it might feel like it in your classroom, you're putting out a forest fire. But the idea of putting our efforts into prevention and early intervention allows us to provide students with support so their difficulties don't increase over time. As students get older and continue to have difficulties with reading, those difficulties become more and more intractable. And so as we know, as students move through the grade levels, text becomes more challenging, literacy demands increase, the risk for difficulties accumulate alongside kind of reading struggles that they may have already had. And it becomes really difficult for students to catch up with their peers if they haven't attained proficiency by 4th grade. And it gets more difficult every year past that. So we want to make sure in those early grades, like in K2, where you all will be screening next year, that we're providing those early supports for students. So sample here, if we're using benchmark assessments, you've likely seen systems like this before. So what benchmark assessments will do is based on students' scores on these short assessments where we administer, they give us information about their level of risk. So they tell us whether students are at benchmark, they're performing as expected. That often in our systems gets tagged as green, or they might get tagged as yellow, which is sort of they're not exactly where they should be on benchmark, and it's worth taking a closer look to see if they need additional supports. And red means they're quite significantly behind benchmark, and they do, for certain, need additional supports in order to make progress. So we have universal screening. This has helped us make decisions at the tier 1 level for students who need additional intervention supports. Now, as students move into tier 2, we're going to start monitoring progress. So we'll collect progress monitoring data. Same as the intervention supports are increasing in intensity as we move up tiers or move from tier 1 to tier 3, the frequency of our data collection is increasing as we move up tiers as well. So as students move into tier 2 and tier 3, we want to collect data more frequently in order to understand whether we are actually meeting students' needs with the instruction that we're providing. So we want to track their responsiveness to the supports that they're receiving. This progress monitoring data is collected only from students who are receiving intervention, because students who are green or not receiving additional supports after universal screening, we don't have to put our resources into collecting this additional data. These are collected much more frequently, and we interpret progress monitoring data over time rather than a one-time data point. So this is a difference from our universal screening, where we collect it at one period and we use the student's performance profile at that one time point to help make decisions. Progress monitoring data, we want to interpret over time, because we're not going to see students week by week. They're not going to have a different profile. So we want to see what's going on as we administer an intervention over a number of weeks. The frequency of this increases. Usually at tier 2, we want to collect progress monitoring data monthly or biweekly, every second week. At tier 3, where we're providing much more intensive supports, and if you consider the resources and time that's going into intensifying those supports, we want to make sure that what we're doing is working and meeting students' needs. We're going to collect data even more frequently. So it's recommended at tier 3 that CBM data, progress data, is collected weekly. So in terms of using this data to make decisions, we know that teachers who systematically use students' progress data when they're in intervention, and that they use their data tied directly to the instructional decisions that they make, are able to affect greater achievement for students with reading difficulties than teachers who are making decisions without systematic use of students' assessment data. In order to do this, teachers need to have adequate knowledge of students, knowledge and skills of how to estimate students' growth, so how to use this data, how to interpret the data, and then how to determine instructional adjustments. So really thinking systematically about what I can do instructionally. So this leads us now, thinking of these data sources we're collecting, to thinking about data-based instruction. So data-based instruction, or DBI, as I'm going to call it from here forward, is a systematic, ongoing process of using students' data to determine when and how to intensify intervention. So the universal screening data we collected is used to identify students in need of intervention or additional supports. And then as students move into those interventions, we want to make sure we're constantly thinking about whether that is working for them. So keeping in mind that not all students respond even to the strongest research-based interventions. Those standardized research-based interventions work for many students at tier 2, but then thinking about the smaller group of students who need something more than that. And so students, in order to do this, we need to use a process where we can make decisions about intensifying or individualizing intervention as required. And to do that, engage in that process, as I kind of started off, we need to have a systematic, well-informed way of making these decisions. And the way we do that is really to be data-driven in the instructions that we make, the decisions that we make. I think I said instructions we make, correcting my own brain. So this is a little kind of map of the steps, the big steps of DBI. And so there are definitely smaller steps involved, but kind of the 5 big steps we go through is starting an intervention, monitoring students' progress, making decisions about their progress, generating hypotheses about what is working or not for a student, and then adjusting instruction to support them. And then the 5th step is really to continue, because this is an iterative process. So once we adjust and change things instructionally, we are still going to have to continue to monitor to see if that adjustment has worked. So I'm going to talk about each of these steps a little bit, how they align with data that we're collecting, and things, how we think about our instruction. So first, and starting with implementing a validated intervention program. So one of the biggest, most important potentially decisions we make is the intervention we adopt at the onset when we determine that a student requires additional support. So these will be interventions that are delivered generally in small groups. They're supplemental to core instruction. And when we decide on them, we really want to think about what we know about that intervention. We want to think about the strength of the intervention. So is there evidence that this program, this intervention is effective for students with reading difficulties or with whatever profile our group of students have? We want to think about the dosage, so the number of opportunities students have to practice and receive feedback. And that could be the number of lessons per week, but also just how interactive those lessons are in providing students those opportunities to practice. We want to think about alignment of the intervention. So is the primary content matched to the target needs of the student? And I'm going to actually come back to this point in a moment. And we want to think of comprehensiveness. So is the intervention, does it include explicit instruction? Does that explicit instruction gradually fade over time so students take more and more independence in their practice and more independence so that they can transfer that to their reading overall? So one thing I want to talk about specifically related to alignment is really thinking about students' word level reading skills. And in the early grades, we often focus on word level reading skills when students need reading supports. And as students move into the older grades, third grade and beyond, we often move into other kinds of interventions that support a range of skills for students. And so I like to make the point when I talk about this that we shouldn't underestimate the impact that gaps in foundational knowledge that students should have, how that will impact their later learning. And it is very common for students in the older grades to continue to struggle with word level reading skills. This is especially true for students with dyslexia, that they will have difficulties, consistent, continual difficulties at the word reading level and need support at that level. But most difficulties in reading tend to occur at the word level. And so I have worked with many schools where at fifth grade, all the intervention that students receive is focused on comprehension. And while that instruction may be great and it may align with a range of what students need, it means that we're not paying attention to the targeted skills that they need in word reading. And so thinking about that alignment piece, that if students are struggling and they need intervention support, that the intervention they're receiving aligns with where their gaps are. So now we have an intervention, we have begun, and as we begin, we're going to start collecting that progress monitoring data. So we're going to monitor students' progress, collecting in whether it's ORF, as I suggested, or another assessment that you all are using in your school. You're going to collect this in order to look at students' progress toward a long-term goal. So a couple of points about progress monitoring data and collecting this data. So one, as I mentioned earlier, when we're progress monitoring, we want to interpret students' performance over time rather than a single data point. And so in order to do that, we will graph students' progress data. So teachers will collect, graph, and then use that graph to interpret students' progress. So a graph may look, oh, I thought I had a graph right here, but it's on the next slide. So I'll get to that in a moment. So before you get to your graph, we'll also set an individualized goal for our students. So on our graph, we'll have a long-term goal where we want students to be at the end of the intervention period. And we want to make sure that goal is aligned with students' individual needs. It is possible that that goal may be a grade level benchmark. If you're working with a student in tier 2 who is not significantly behind their peers, who needs additional targeted support, the goal you might graph could be a grade level benchmark. For students who need more intensive support, and as they get older, as they move through the grades, that goal really has to be individualized to where they are starting the intervention. If you work with students in the older grades or students who are really struggling with reading, you know that it is often not realistic to expect them to get to a grade level benchmark within 12 weeks or 16 weeks. They'll need more intensive support over time. So we want to make, even though we want them to get there. But when we're graphing our data, we want to use an individualized goal so that we can accurately understand that individual student's progress over time. So a quick example of an individualized goal, I'm going to give an example here for a third grader. There are kind of, they're not rules, but kind of estimates that exist in the world of kind of, especially this is for ORF, of how much progress we expect students at different grade levels to make weekly. And so these are weekly expectations that at third grade, students likely increase about 1 word correct per minute per week when they're in intervention. And if we have a more ambitious goal, so if we know this student is really making good progress, if we are giving them very intensive supports, if we have seen the student just seems like something has happened and they are ready to kind of move forward, we can set a more ambitious goal. And at third grade, the ambitious goal is 1.5 words correct per minute per week. So you can see as students move up in the grades, the rate of growth is not as large as it is in the early grades. So the way we would calculate this very briefly is their goal would look at where they started, their baseline, and then we would add that to the goal rate. So in this case, 1 word correct per minute per week, and the number of weeks of intervention. So where we're going to expect them to be at that goal. So what would that look like? If a student in third grade was starting at 40 words correct per minute on an ORF CBM, I would say that the goal rate, I decided I'm going to be ambitious. I'm going to say they're going to increase 1.5 words correct per minute per week. And my intervention, the goal I'm going to set for them is the end of the academic year. So I'm going to say that's 34 weeks of intervention estimated with holidays and everything that comes into that. So 1.5 times 34 is, I covered my screen, 51. There we go. I was like, my math's not good enough. My mental math's not good enough to do that without looking at my screen. So it's 51. So I would expect by the end of the year, I would see 51 words correct per minute progress. And I would add that to where they started the baseline. So the goal I have for this student is that by the end of the year, I hope that this intervention will get them to reading 91 words correct per minute on their ORF assessment. So then I would take that goal and I would put it onto my graph. And so this graph is not a 91. I should match this up with my 91, but it's a little less than that. Different student starting at a different place. But this is an example of a graph across 14 weeks. So the teacher who created this graph set that they're going to set the goal for their students at 14 weeks, which may be a term, it may be the first half of the year, it may be when intervention blocks change out. And on the graph, we're going to have the number of words correct per week. So their score, their CBM score each week, that it's these blue dots throughout. We're going to have their goal line. So the goal line is their baseline down here where they started, that individualized goal I just talked about that I set for them at the end, at the final data point. And then I'm going to connect those two lines so that I see what their trajectory is, what their expected rate of growth is over time. And then I'm also going to calculate a trend line. And so if you use this in Excel, or I have a program that my team has developed that sort of auto calculates trend lines, we have students' actual rate of growth is taking into account their scores each week. And this trend line repopulates each week as we collect new data to tell us where students are at as they move throughout the year. So this blue dotted line, the trend line, gives us a sense of students' actual rate of growth compared to where we want them to be. And if they are not where we want them to be, then what that's telling us is that they're not making enough progress to get to, or the intervention is not intensive enough for them to make the progress to get to that goal that we've set for them. So this graph, as I mentioned, has the baseline that we put on there. That having an accurate baseline is extremely important. And sometimes we start intervention and don't collect this baseline data point or haven't decided what data we're going to collect to monitor progress yet. So we want to make sure when intervention begins, we know how we're going to monitor progress and we collect baseline data. And then we have our data points. We want to make sure that when we're making decisions, like I said, we're looking at performance over time. So we're using at least kind of 5 weeks of data to make a decision or 5 data points to make a decision. And when students have much more variable performance over time, then you need more data in order to get a more stable trend for that student. So a couple of things to think about when looking at a progress graph like this, as my slide moves, you're going to make a decision next. Is the student making sufficient progress to meet the long-term goal I set for them? And so I'm going to show you a graph and kind of talk about the things to think about. I want to make the point here that often when we talk about making this decision, whether the student has made sometimes said, is the student making adequate growth? Is the intervention adequately intense for the student? Is the student responsive to this intervention? It's often portrayed as a pretty easy decision. We're just looking at a graph and saying yes or no, are they making progress? But there's a lot that really goes into making that decision, interpreting students' progress data, and understanding whether they're kind of making the growth they need to get to our goal. So we'll use that graph to make instructional decisions comparing what I was talking about before, the trend line, that blue dotted line, their actual rate of growth, to their expected rate of growth, their goal line. And we will think about a couple of things. Or I'm going to talk about 3 things actually, so a few things. One is really being clear that we started with an individualized goal for this student. So if I'm starting with a student, so my example of a 3rd grader who's starting at 40 words correct per minute is pretty significantly behind where we would want a 3rd grader to be at the beginning of the year. And so if I set a grade level benchmark for that student, and then I graph their data and compare it to that grade level benchmark, the goal line that goes with that benchmark, it may look like they are never making enough progress because the trend line, this blue dotted line, will always be, unless the student has a miraculous response to the intervention you're providing. But this trend line is going to move more slowly than the goal line that you've set. And so we really want to make sure that this graph, it doesn't mean we shouldn't look at that grade level benchmark. You can even add to the graph the grade level benchmark in addition to the individualized goal. But we want to make sure when we're making instructional decisions, when we're saying, is this intervention intensive enough or working for the student, that we're really thinking of them individually and where they're at. The other thing on this graph is keeping in mind variability. So it is very common for all students to have variable performance on CBM progress monitoring assessments. For students who have difficulties, this variability increases even more. For students who have reading disabilities, they have extremely variable data. From week to week, it would not be uncommon for them to have a difference of 20 points but each week as they move forward. And so that's why it's so important to interpret this over time, because if we're using single data points, it really, I mean, it can be an emotional roller coaster for us as the teacher, that each week we're like, it's working. What I'm doing is working. Oh, no, it's not next week. Oh, it's working again. So we really want to understand how things are moving over time for that student. And so not being startled or shocked or responding too quickly when we see this normal variability in the data. The other thing I'll point out is, especially for students who have reading disabilities, having outlier data points is often very common. So a student will have a week where you administer a progress monitoring probe, a CBM, and they either score significantly above where they have in previous weeks or significantly below where they have in previous weeks. And so that outlier data point can be related to all. I mean, we would also have, if we're collecting data on things we're working on, outlier data points as well. And so it's related to things happening that day when they're assessed. It can be related if you're using ORF to the topic of the text they were reading, certain words that were in the text that they were reading that they may have already been familiar with or weren't as familiar with. It could be a topic that they like and they are knowledgeable about, so it helps them get through the text because they're more familiar with the words and the vocabulary. And so, and everything else that goes into just our performance on a day-to-day basis. So thinking of when we have one of these significantly outlying data points is not a reason to be startled or panic, but keep that in mind as we move into the next week to watch what happens after. I'm waiting for my slide. There we go. Okay. Little pause on my animations. So if we're looking at that graph and the actual rate of growth is lower than expected for the student, they're not making enough progress to get them to that goal that we set by the end of the intervention period, then we know we need to change something instructionally. We need to do something to either better align the intervention with the student's needs or intensify that intervention to meet the student's needs. So before we go into making decisions about instruction, we're going to pause and ask, do I have all the information I need to determine how instruction should be adjusted? So ORF data is extremely reliable and effective for giving us an estimate of students' progress. It tells us that students are making growth or not. But what it doesn't tell us is it doesn't narrow down on a more fine-grained level to tell us where we might need to fill gaps for that student. And so that's where we need to think about, do I already know how to fill those gaps, or do I need to collect more information? So this moves us to the third step of DBI, which is generate hypotheses or collect diagnostic assessment data to help us understand students' profile. So diagnostic assessment data can be, and I'll give you several examples, but it can be very informal diagnostic assessments that really help you determine a student's area of individual need or gaps in their skills. And so it's more fine-grained than the assessments we're collecting, the universal assessments we're collecting, or the ORF data we're collecting weekly or biweekly, depending on how often you're collecting it. So thinking of ORF, fluency is not an isolated skill. And I mentioned earlier, reading fluency is a proxy for overall reading achievement. It's a very good proxy for overall reading achievement. But it sort of encompasses all of the other skills that students use as readers. So we want to help understand where students might need additional support. So diagnostic assessment data, there may already be data that you have that you can use to make instructional decisions. So this does not mean you always have to collect new diagnostic assessment data. Sometimes this might exist already. But there are potentially a student might have had an educational assessment recently, and so there might be more information on there about student skill profiles across different levels of different ways of learning and different cognitive skills. That might help give you information about what could be effective instructionally. And then you can also collect informal data throughout your intervention. So one way to do that is an ORF error analysis. So when you're collecting this ORF data, you can also be really certain to clearly mark down what any errors students make and what they say when they get a word incorrect, and then do an analysis of where their errors are falling. So what kind of categories do their errors fall into? And what does that tell us about how I can supplement or fill gaps for them? And so my team and I actually have a paper that just came out on error analysis that goes into detailed examples about how to use your ORF data to give you the secondary source of information, and talks about how you would categorize errors in looking at phonological errors students are making, orthographic, morphemic, whether they're making errors consistently with high frequency words. And when we see what kind of errors they're consistently making, if there is a pattern, that helps tell us where we could give mini lessons or sort of supplement knowledge for students as we're going through our intervention. Similarly, you could do a spelling error analysis. And so you can actually, I always do this. You can have students write just a few sentences or a paragraph, I often will strategically choose a set of words and then do kind of a spelling activity with students and then look at how they spell those words. And I'll strategically choose words to fall into these different skills or things that we want students to have and not have knowledge of to support their reading. And so I'll look through and see, are they consistently making errors with vowel teams? Are they consistently making errors with R-controlled vowels? Consistently making errors with more complex words that have prefixes and suffixes. And it's often said that I think it's Louisa Moats has a quote that like spelling takes a magnifying glass to our development as readers. And so looking at students' spelling knowledge can give us a sense of the knowledge that's very secure and mastered for them and where they might need additional support. Another example, a less informal, kind of a structured assessment you could use a phonics inventory. This one is from Houghton Mifflin. It's a really simple phonics inventory where students read through, like on the box on the right, in where the arrow is, they would read through these words and you would mark which words they read correct or incorrect. And these words are already grouped for you as the administrator into different kinds of skills that we want students to develop over time. And so how they read these words will give us some knowledge of what skills we might need to work on. The other thing I'll add here, I don't have an example of it on a slide, but another very important thing to think about when we're generating our hypotheses or we're thinking about collecting that diagnostic assessment data is really, are there other things outside of reading skills that we need to support in order for the student to benefit from this intervention? So are they not engaged or attentive during instruction? Is behavior an issue? Are they, are they not focusing on what you're talking about? So if they're quiet through the whole lesson, but they really just have not been listening to you while the whole group is engaging, it's unlikely they're going to benefit from the instruction. And so thinking about other kinds of supports for students to make sure that they have opportunities to engage, that they have supports for their attention if that's needed, that they have supports for behavior if that's needed. So some of that diagnostic assessment data might be informal in terms of your own observations over time or your own notes over time or what you know of that student. And sometimes it's hard to tell when we're teaching what the other students are sort of doing or thinking or how engaged they are. And so sometimes I recommend if you have a student who's not making progress and you're not really sure what to do next, you could have a colleague observe your lesson and sort of pay attention to that student during the lesson, how often they're on task. Are they listening or are they sort of thinking of other things while you're talking to help you hopefully get some information about how they're doing? Then based on that information, all the information you have about that student, you're going to make an instructional decision. So you're going to decide, what could I change about this instruction in order to better meet students' needs? And I'll go through some examples, but even before I get to this first one, I do want to say that this instructional adjustment, the goal here is not to throw out your intervention and start something new. We're going to assume that at the beginning of this process, we chose an intervention that had strength for students with this type of difficulty, that was aligned with their needs. And so we're not going to start a whole new intervention. We're going to adjust things about the instruction in order to really address what they need within that instruction. So some recommendations for how to adjust instruction. First is thinking about whether the dosage is adequate. I would say this is the most commonly recommended way to adjust instruction. And I will talk about it for a moment and then I will give my own caveat to this. So the way we think about dosage is increasing students' opportunities to respond and receive feedback. And so that might include increasing the duration of the intervention, how many, seeing them over a greater number of weeks or expecting growth over a greater number of weeks. Increasing the frequency, so rather than 2 times a week, working with them 4 times a week, and increasing length, so rather than a 30-minute intervention, a 45-minute intervention. And the other way to change dosage would be decreasing group size. So you will see, especially in tier three, it's recommended if students are making progress, go from a small group to individual intervention. And so those might be very effective adjustments to make. The caveat I always give is they're not always the most realistic adjustments to make when you are in a school where you have a schedule where you're providing intervention to many students. It's often not within our purview just to change the schedule for a student or see them more time, even if you want to, or to see them individually. So sometimes we do reach a point where we really say, this student needs more instruction time. This student needs a smaller group size. But there are other ways to think about our instruction before we start shifting intervention schedules every time we determine a student needs something more. I also put a note here, kind of check intervention, which is the other thing we want to do is at this point, if a student isn't making progress, we should take a moment to reflect back on our selection of the intervention just to make sure that the intervention is aligned with their areas of need, to make sure that it doesn't include a lot of extraneous skills. So am I spending a lot of instructional time going through skills that students have already mastered in previous interventions or previous grades? Am I really focusing my time on exactly what they need? The other thing in thinking about checking the intervention or aligning the intervention is really also taking a moment to think about the text that we're using within our intervention. So are we selecting text, and we could potentially deviate from what the intervention might already have integrated within that text. But if students really need to work on decoding and fluency practice, if they are developing foundational reading skills, making sure that they have the opportunities to read some decodable text. Doesn't only have to be decodable text, but some opportunities to practice with decodable text. So they're transferring the skills they're learning directly to the text they're reading. Working with, if we're supporting students' comprehension of vocabulary, having read alouds or opportunities to engage in other text that's more comprehensive or includes a greater range of topics. And then consistently making sure that our text has rich narrative, culturally relevant text, that our informational texts are on topics of interest. They aren't always, but sometimes opportunities for students to read informational text that really just gets them interested in reading to the end to find out what the answer is to the thing they're reading about. So next, if we need to make an instructional adjustment, thinking through, is the program that they're receiving explicit enough? Is the instruction that they're receiving explicit enough? And so evaluating how principles of explicit instruction are integrated within that intervention, and making sure that the intervention is explicit and systematic enough to support their progress. This is especially true for students who may have persistent difficulties over time, especially at the word level, that instruction really needs to continue to be explicit as they move forward. And targeting these skills explicitly for novices, so students who haven't mastered skills yet in the early grades and are getting early intervention supports, and for struggling learners. So elements of explicit instruction, these are elements taken from some of Anita Archer's work, who talks about the use of explicit instruction for novice and struggling learners, but really making sure that we're targeting skill areas, that we have really systematic and cumulative instruction that helps students. We are very clear with them how they are building on the things they have learned before. We give really clear goals and expectations for what we're working on. We tell them why it's helpful to know this thing we're about to work on. That we move into practicing a skill, but we demonstrate as an instructor. We provide scaffolds for them to practice with a level of success. And then we, over time, gradually remove scaffolds for them to practice independently. And we continue checking for understanding. We use clear and concise language as much as possible. Students are engaged in the process of learning. And instruction is brisk and engaging. This is what Anita Archer also often calls this, my team loves saying, a perky pace. And so when you're working on these skills, this can be long for a student. They can get, distracted while you're talking about a phonics skill for 5 minutes, making sure that we're brisk and moving through instruction and moving from explaining to practice, explaining, practice, and support throughout. Thinking through whether there's attention to transfer and generalization. So I'm going to give a really simple example here where an intervention is set up to support a student's transfer of a skill they're learning. So a simple example of that is sometimes in a lesson in foundational skills, we might see students taught letter sounds. But are we structuring that for them to transfer letter sounds, to then reading those letter sounds in words, and then reading words with those letter sounds in connected text, sentences or passages? And so simple example would be, I'm working in a lesson on the R control val AR. We do this in isolation. AR says R, they have practiced saying this. And then we read a number of words where AR appears. And we work on proficiency with reading these words. And then we move within the same lesson. We move from reading maybe not all these words, but some of these words into reading a level of connected text. And so making sure students don't stop fluency at just the word level, but then when they get to sentences and passages, they can maintain that fluency. Also thinking of generalization, especially as students move into the older grades, of how we connect it to what's happening in their core instruction as much as possible. And this can be challenging if we're really targeting foundational skills, but thinking of how we can give them enough practice approaches to take back and use when they're reading independently without you there as the intervention support. Making sure that in all of our lessons, students have a lot of opportunities for practice. And we want to make sure the practice is with feedback, that it's structured in a way that they can be successful, and that it becomes more difficult over time with that feedback and support. But students really have to have opportunities to put the skills they're learning into practice in order to become confident with those skills and generalize those skills to using them on their own. One way, I have a quick slide here, but I'm going to go through it quickly so I can make sure we don't run out of time, is engaging in a lot of oral reading practice with students. So doing that with your whole small group, providing feedback, but thinking of ways where we can optimize that practice without the instructor always having to lead it. So teaching students procedures for partner reading practice. So students understand how to work with a partner. They have a routine for who's the reader, who's the teacher, how to give each other feedback, and they are able to get through oral reading practice at a greater level than if it is all teacher-led. And then last, going back, I mentioned this briefly before, but also thinking in terms of adjustments, whether students need other learning supports. And so sometimes it's that the way the intervention has been set up or the way the environment is set up is not working for the student and not working for their particular learning needs. So thinking about attention, motivation, engagement, student self-regulation, both in terms of being persistent with their work, asking questions, recognizing when they don't know something, all of these skills, thinking about how we can support students with these other areas as they're going through an intervention. The perky pace that I mentioned before often goes a long way with engagement. So if students find something difficult or challenging, or if they have difficulties with attention, if the instruction is slow and not moving at a quick pace, then that is sort of prime for them to disengage with what's happening. So making sure we're trying to pull students in as much as possible, thinking about whether we need to add supports for attention, whether a student might need specific behavior supports that need to be integrated into that intervention. So essentially thinking about our instruction in terms of reading skills, but then also thinking about sort of the broader foundation of how they're receiving instruction and where they are learning and whether that's working for them and how I can support them more in that environment. And then last is continuing to monitor student progress. So I've made an instructional adjustment. I decide I'm going to do 2 or 3 minutes at the beginning of each lesson where we focus on reviewing GPCs, grapheme phoneme correspondences that students have learned before, but I know that the student is still struggling with them. So we're going to do some review and practice at the beginning of each lesson, for example. And then I'm going to continue monitoring their progress at the same schedule as I was before. I want to make sure that what I did is working, that actually does meet the student's needs. And if they are not making progress, if we go back to the graph, then I will make another instructional adjustment and I'll continue to monitor over time. So I wanted to sort of throw out a couple of quick like comparisons between tier 2 and 3. So this model, these steps really can be used parallel whether you're providing tier 2 instruction or tier 3 instruction. If you're in tier 2, if you're thinking about the intervention that you're selecting, that intervention might look different whether you know a student is getting tier 2 supplemental instruction or tier 3 more intensive instruction. The easiest example that comes to mind is that if students are receiving tier 3 more intensive instruction, the intervention is usually much more targeted to a specific area where they need support to fill gaps or needs in their learning. And that targeted intervention would then move into another targeted intervention or a more comprehensive intervention. At tier 2, students often need something supplemental, sort of to help them continue make progress or address things that they haven't yet mastered. And so the intensity of the intervention differs between the levels. We're monitoring student progress, as I mentioned at the beginning. The frequency that we're collecting this differs. So at tier 2, you might be collecting progress monitoring data every 2 weeks or every month. And we're sort of looking at every several data points and deciding whether or not this is working for the students or whether they need some additional support. At tier 3, students are significantly behind. It becomes much higher stakes that they make progress and move toward kind of a benchmark, a goal that we want them to get to. So we want to collect data much more frequently so that we're able to look very regularly at their data and figure out what else I can add to the instruction or what else do I need to think about instructionally. Then thinking about other kind of information we'll use and how we're going to change our instruction, what we're going to do in terms of our adjustments. When we move to tier 3, this is where instruction becomes more individualized. So at tier 2, it's more intense, like they're getting intensive supplemental support. Tier 3 is even more intensive. And the way we do that is by individualizing the way students are getting instructional adjustments. And that doesn't mean a whole different intervention for every single student, but it means the supports that I tweak or add to my intervention are decided at the individual level. And continuing monitoring progress, just keeping in mind that at tier 3, we would expect growth to look different. If students have that need for more intensive supports, they should be making consistent progress and growth over time, but it won't be at the same trajectory as we would see for other students in tier 2 or students who don't have difficulties. So to wrap up, I kind of summarized this into 10 big takeaways to think about. One that hopefully touch on different things I've talked about over the last little while. So one is that research-aligned core instruction is essential. So if we're going to meet the needs of the majority of our students with high-quality core instruction, then making good decisions about how we're providing instruction and the rigor of that instruction at tier 1 is very important. It serves as a foundation for everything else that we're doing. 2, we're going to then collect universal screening data to identify students in need of intervention supports. So teachers usually have a good sense of who needs additional intervention supports, but we don't want to just rely on our judgments all the time. We want to have data that we're using so we can make well-informed, consistent, systematic decisions. As students are screened and we determine that they need additional support, we move to 3, having high quality interventions delivered in small groups that are targeted to students' needs. 4, that instruction that they're receiving is explicit and systematic in its delivery. 5, that intervention and that support they're receiving should also include many opportunities for reading practice with feedback from you or peers, but with regular feedback. 6, as they begin these interventions, we're having ongoing data use to monitor their progress. So we're not, as students start an intervention, I'm not going to assume that this is going to work for them. I'm going to make sure that they're making progress. In order to do that, 7, I'm going to set an individual student goal in order to know where I want them to be, what kind of progress I want them or expect them to make, and whether the intervention is helping them get there. 8, I'm going to graph their data over time to allow me to understand their rate of growth rather than relying on single data points to inform my decisions. 9, if they're not making growth, if they're not growing at a rate that I would expect, I'm going to use other information, informal diagnostic assessment data to identify their areas of need or skill gaps. And then 10, if they are not making expected rate of growth, I'm going to intensify and individualize interventions as students need that. So I will end off there. I have my contact information on the screen. You're welcome to contact me anytime. My team has a YouTube channel where we have some resources and videos. We have an Instagram where we post resources and videos, but also fun things. So you're welcome to follow us there too.
That was wonderful, Dr. Tost. I just have to say, so great to hear all of those important application comments. And it's just really important for educators to understand the way in which to do the intensification supports. So thank you for all that you conferred today. We are done for today. We don't have time for questions, unfortunately, although there were a lot in the Q&A. So as you all are filtering into the next thing that you'll be doing, which we'll be talking about in a moment, we may take some time just to answer a few of your questions in the Q&A. That said, we are going to move along to the survey, and we'd like you to fill out this last survey that's related to Dr. Tost and her presentation today. And then we do have another survey following up this one on the PLN in general. So we encourage you to fill that out as well. So first, this is for Dr. Tost. We'll put the link in the chat. And then here's the final survey that talks about the PLN in general. So 2 surveys back to back. This completes our webinar portion of the day. You will now head into your Hub Leads Zoom room to debrief on today's learning and discuss takeaways to your instructional practice. The Regional Hub Zoom room links are located in the document in the chat that we'll be adding. If you're not an LCRS site, but would still like to debrief the discussion, please join any county office that is closest to you for that discussion. To all the presenters, I want to thank you for your time on behalf of Glean Education, Sacramento County Office of Education, Napa County Office of Education, and the LCRSET Grant Initiative. Thank you to our wonderful attendees. We really look forward to seeing you sometime soon in the future. Take care, everyone, and goodbye.